We were founded as the National Association of Theatre Nurses in 1964 by our founding member, who was Daisy Aris. She was quite a trailblazer for her time. She wanted to share best practice and make sure that we engaged with each other working in the perioperative environment. She went across to America and saw how their organisation worked and came back enthused with the passion for sharing that culture and patient safety. So she founded the National Association for Theatre Nurses in Leeds in West Yorkshire, and obviously this year is our 50th anniversary year, and we're celebrating 50 years of sharing best practice, engaging with our members. So I work very closely with the Board of Trustees to make sure that we're meeting our charitable requirements, which is to promote safer surgery within the perioperative environment. We like to work in collaboration with the medical device partners because they're passionate about patient safety just as much as we are as an organisation. And through our accreditation programme, we can accredit their learning, which enhances the use of their equipment. So they're making sure all the time that when they put a piece of equipment into a theatre, the people who are going to use it are trained effectively, and we endorse that training and accreditation for them. So we have that link, and then we use our medical device partners to sponsor us for regional study days and different events across our year to get them in front of the people who are going to be using their products and to sort of enhance that safety feature, really. The procurement processes, the medical device partners are having to justify all the time how they spend their money, and it has to be linked to education. So for them, the NHS procurement has changed, but also the way that the medical device partners work has changed. So we've had to develop our ways of working to bring those two things together to make sure that we still have that cohesive way of collaborating on educational projects. The Francis report has had an impact on AfPP because it highlighted the appalling care that was delivered at the Mid-Staffs Hospital, and a lot of the things that came out of the Francis report were around the interaction with patients rather than the actual patient care. We all assume when a nurse or a practitioner is working within practice that they've had the relevant training to skill them up to be able to do that job, but we don't always train them in the human factors elements of delivering that care. So we've been talking recently around communication, the situational awareness and things like that, and those were all the elements that Francis sort of mentioned as part of his report, and how the communication had failed, and because of that the care deteriorated as a result. Because of the Francis report, it's given AfPP an opportunity to look at its curriculum of learning and how we provide that learning to our members, and we've developed a whole team training package that gets whole teams within the hospitals together, so from the surgeons right down to your healthcare assistants, because teams who work together should train together, and that gives them an opportunity to build a safe environment where they can speak up and speak out. And if things aren't going in the way that they felt they should be going, it gives them an opportunity to say, well, when we did the training, we agreed that we would behave in a certain way, and if they're not behaving in that way, then it gives them that right to say those things because they've all agreed that that was the way that they were going to work together. So we've built that curriculum to be able to support the outcomes of the Francis report. AfPP's objectives for the next 5 years have been set through a strategic plan that the trustees and myself have been involved in producing, and our main objective is to grow our membership, because the stronger our membership, the bigger the voice we have in the perioperative environment, and that gives us more opportunity to deliver our charitable objective, which is to promote safer surgery within the perioperative environment. We currently have around 6,000 members, and we gain members every month, but we lose members off the other side for different reasons. So it's about making our membership benefits the benefits of choice for people working in the perioperative environment, so we become the association of choice for those individuals. We want to develop our training arm, so our whole team training, our consultancy, and we can only do that through working closer with the NHS. but our members are key to what we do as an association, and I think that's where our focus will be over the next sort of 3 to 5 years.